So talking now about what we can all do, every single person can do to improve our heart risk, I think is very well laid out by the American Heart Association's Life's Essential 8. And many of these things work together, and they work on more than one of the risk factors. So it's not just one to one, they are helpful in many spheres of health. The first one, and I think the most important one, is just simply to increase your physical activity. You got to exercise. It's the number one best thing you can do for your health in so many ways, not just for your blood pressure, your body mass index, your weight, your cholesterol values, your blood sugar, that you'll sleep better. Actually, some people will say that, and it's been shown in several studies, that your mood can be helped tremendously, the same as taking a medication for depression. So these are huge, huge area for improvement here. So what the American Heart Association and the American College of Cardiology recommend for activity at a minimum per week is 150 minutes of moderate level exercise, or 75 minutes of heavy exercise, or a combination, plus 2 to 3 days a week of resistance training. And those can be combined and moved around how you can need to do it for your life. It's best if you can do a little bit every day, but we all have busy lives, so do the best you can. If you're not doing any, you're going to do better if you can do anything than if you do none. Some people say, what's moderate? How do I know it's moderate? How do I know if it's heavy? And I think the easiest way for anybody to tell is if you're with a partner doing a walk and you can talk, but you could not sing a song, that's moderate. If you can sing, that's light. And if you can't talk at all, that's heavy. So that's an easy way to kind of gauge your activity level. You could also use wearables and fancier technology, but hey, talking and then singing is free. So let's start with that. And that's what I would say. The type of exercise, there's a lot of ways you can look at that. I think you should do whatever exercise, whatever you can move your body with, you like to do, that you'll continue to do for the long haul. So that's the easiest thing to think about for me. And it should continue to be hard. You should increase your level of exertion over time. You're trying to challenge your body. You're not trying to make it easy. So your body will respond if you keep challenging it. And it's supposed to be hard. Easy thing to slip into easy exercise that's relaxing. We do want to challenge it. All right. So number 2 is eat better. And what is a heart healthy diet? While a bit of a debate, it's still quite clear that a plant-forward diet like the Mediterranean diet is definitely proven to lower your risk of heart disease. You don't necessarily have to be vegan. You don't have to be vegetarian, but eating your food, total food intake should be a lot more plants than most Americans eat. And this is unprocessed food, ideally. So you can't go to the store and buy the plant burger that's processed and expect that to be a healthy thing. We want to think about a plate. Half of it should be something green. A quarter of it should be something protein, and that could be beans one day. It could be some type of meat or fish another day. And 1/4 of the plate can be your starch. Most people have those ratios kind of mixed up, where half the plate is their starch and bread and rice, and then they have a tiny little bit of protein and a tiny little bit of green, if that. So as long as we get the vegetables in, we're improving our overall health, and we are getting things like fiber. Getting a lot of fiber is hard. You want to have, if you're a woman, 25 to 30 grams a day. If you're a man, you're going to get more like 30 to 35 grams a day as a goal, and that's difficult. So you really have to be intentional in what you're putting on your plate so that you get these nutrients. Getting that much fiber will help lower your cholesterol. It helps a lot lower the risk of cancer. There's a whole lot of benefits to a very heart healthy diet. When we talk about things like fats, we want to prioritize healthy fats. While the total amount needs to be relatively small, you want less than 7 to 10% of your total calories to be from saturated fat, so a small amount. Saturated fats are things that are solid at room temperature, like butter and lard and ghee and all those things. So small amounts, little bits are okay, but a very little bit. About less than a tablespoon a day is a good way to think about saturated fat intake for a whole day. And the rest of your fats can be unsaturated, things like olive oil, avocado oil, those kinds of oils you can cook with or use small amounts to garnish vegetables and things. Fruits and vegetables, you want to stick with fiber. Juice does not count, unfortunately. You want to be smart about it. Continue to prioritize lots of different kinds of fruits and vegetables. And we also like fish if you can eat fish at least once to twice a week, and getting wild fish as opposed to farms tends to help lower your mercury content. And we have to think about that too. Nis, do you have anything to add here so far?
Oh my goodness, beautifully done, Britt. I love it. I remember that when I was pregnant is when I was most careful about making sure I was eating Mediterranean diet, and I would look for wild Alaskan salmon wherever I went because that's the one with least amount of mercury. But I love how Dr. Young has mentioned about not just being intentional about what's on your plate, but also looking at the quality of the starch, the quality of the protein, because it goes beyond it just being a protein. There are other safety issues we have to keep in mind. So I love it. Thank you. Thank you, Dr. Young.
If you have the ability to, I would always prioritize grass-fed over conventional types of farmed meats as well. And that's a really good point about the quality of our food. If we're going from a completely processed diet to a healthier diet, just do the best you can. It can be expensive. So, I would prioritize the big parts of your diet. If you don't have to have all organic, but looking for, there's a list of vegetables you can look up and fruits that are the most prone to being exposed to pesticides, and keeping an eye on those things as well. But those are small details. So just big picture, a lot of green stuff, a lot of colors, varied, try to switch it up, wild caught and grass fed over conventional as much as you can. Okay, moving forward, the third one in our life's essential 8 is not to smoke. And I do include vaping in this category. So smoking and vaping, you're breathing in combustible particles of something. And you can smoke anything and it's not good for you. This is highly inflammatory to your blood vessels, and it predisposes you to heart attack and stroke and coronary artery dissection, which I know Dr. Sareen has a special interest in. So just anything you breathe in that's been combusted is terrible for your heart, and you should just not do it. In addition, if you have a population of people whose hobby involves being exposed to things like vehicle exhaust, like truck drivers or people who like to ride motorcycles as a hobby or so forth, or work on cars, they're also at a little higher risk because they're breathing in this particulate matter, which is highly inflammatory. Some people don't know about that, so I like to mention it. Number 4, we talked about this a little before, but getting healthy sleep. You need about 7 to 9 hours as an adult, and your children need more than you think. So I would just look up what your kids need at different ages as well, because not many of our kids are getting what they need, and starting them off with good sleep will lead them to a healthier life than what we had as children. So 7 to 9 hours. If you're getting under 6 or over 9, there might be a problem. And I would consult your primary doctor or a sleep specialist if you think you're not getting good quality sleep. And there's a note here I would like to mention about sleep apnea. Sleep apnea is not the same at all as snoring. Snoring's a sign of it sometimes, but you don't have to have it to have sleep apnea. You don't have to know you have sleep apnea. You might think your sleep is good, but if somebody that has seen you sleep sees you stop breathing when you sleep, you need to get evaluated. If you're waking up and you have unrefreshing sleep, you should probably think about being evaluated or at least screened for sleep apnea. If you did have sleep apnea, it means you're not getting oxygen when you are sleeping. Your body is attempting to get it, but it's just not getting it. And it's a tremendous strain on your cardiovascular system. So we overlook it, but treating those types of sleep disorders are extraordinarily common. We can't overlook that. Dr. Sareen, do you have any thoughts about that?
Well, thank you for mentioning that, Britt. It's such an underdiagnosed condition and underrated. Sleep apnea can lead to pulmonary hypertension, can lead to heart failure. It's a very common cause of atrial fibrillation in women as well. So if you are not getting good quality sleep, please be proactive to ask your physician, could I have sleep apnea? Because you're going to prevent a lot of issues if you have it and you use the machine.
Absolutely. I love it. And just a little word of um, make you feel better about getting tested. A lot of times now we do these tests at home. You don't even have to go to a lab 90% of the time. So this is much better than it used to be in terms of diagnosis. All right. So the next of the life's essential 8 will be to manage your weight. So a healthy body mass index between 18.5 and 24.9 is what we're shooting for. Um, Body composition testing can be used if you think that maybe you have a lot of muscle mass and that's why your weight is higher and your body mass index is higher than it, you think it should be. We can do that in a lot of ways. DEXA scanning is one way to do it. It can be done, but I think that's best done through your doctor. Just keep an eye on your weight. It will creep up slowly and gradually every year in all of us if we don't take changes in our diet and our exercise patterns. I think that basically the benchmark of what happens with weight gain is you'll gain about a pound or two every year after you turn 50. And that's a lot of pounds if we're going to live for a long time and be healthy. So we do have to keep an eye on it. Our metabolisms just decline and our activity levels tend to decline as well for a number of reasons. So we have to be very intentional about not gaining weight slowly. All right. So back to cholesterol, my favorite. I would definitely make sure you are screened for high cholesterol. Know what your cholesterol numbers are. And this is not like a one time in the life thing that you should do. You should have this checked frequently, every year, every other year. If you are a woman and you hit menopause, that is going to make your cholesterol go up. If you had been on hormone replacement therapy and you're taken off of it, your cholesterol is going to go up. If you change your diet and you think that, okay, I'm going to have a lot of protein, sometimes there are people who respond to that in such a way that their cholesterol goes up a lot. So this has to be monitored carefully, and we can certainly do that. I'm a preventive cardiovascular specialist, so I do this all the time, and we can change it. We can change it with diet. We can change it with different interventions, and we can use medications when they are necessary. The lifestyle is always the foundation. The blood sugar. So the blood sugar is something that's a little harder for you to guess at on your own, but we do have ways to assess it that we didn't have in the past. And you can get a continuous blood glucose monitor without a prescription. You can wear it for a couple of weeks. You just stick it on your arm and it will tell you through an app what your blood sugar is approximately in the course of the day, just moment by moment. And I think that is useful if you think you got a blood sugar problem, meaning your blood sugar is too high, probably. And you can see how you react to different foods. Sometimes people will react in ways that they don't think they're going to. And sometimes it's about portion. If you eat a whole cup of rice, it may spike your blood sugar really high. But if you eat a half a cup of rice, maybe it won't. And you have to find out what your particular body does with different kinds of foods. A lot of people are very surprised when they find out that, oh, a fast food place with a white bun, that might spike your blood sugar. When at home, if you make it without the bun, it doesn't. And so you can modify these foods that you enjoy in ways that really help your blood sugar over time. And it's really that timely feedback with, oh, this food did that to me. Then you know what you can and can't do safely in terms of your diet. So that's a great thing to do. Another thing I will always say is if you have just had a meal, and that's when your blood sugar will go up. One way to make that go down is to take a walk. Take a walk after you eat, 10, 20 minutes after every meal, and your blood sugar will thank you for it. That's an easy, quick thing. And the final thing in Life's Essential 8 is manage your blood pressure. So first you got to check it with a validated monitor. The arm cuffs are always better than the wrist cuffs, just so you know. You got to choose low sodium foods, like don't add the salt to your food. You get plenty of salt in what you're eating already. You got to exercise. Your blood pressure will drop after you exercise because it relaxes your blood vessels. It is a treatment for hypertension to exercise. If you have a night of bad sleep, it will raise your blood pressure. If you have sleep apnea, it will raise your blood pressure. And if you treat it, it gets better. So these are all things that we can do. They're simple things just to be aware of. Take them to your doctor, discuss them, do little small interventions with all of these areas, and you'll be a much healthier person in the decades and decades to come.
Thank you, Dr. Young. I could not have imagined anybody else do it more beautifully, more eloquently, and more gracefully. Things that we ignore every day that are so important and can be critical in a long, healthy life, which is the ultimate goal for every single one of us. Thank you for taking the time to be here today. Thank you for sharing your expertise. If you have any questions, our listeners, please email us on beyourselfcontact@gmail.com. If you have suggestions for the next podcast, please let us know. I can already sense that we'll probably have to bring Dr. Britten Young back. So thank you for your time. Thank you. It is always a pleasure talking to you, Dr. Young.
Just a delight to be here talking with you about these things. I'm very passionate about them. I could talk about them for hours. I would be delighted to do it again. Thank you so much, Dr. Sareen. I appreciate it.